Hello. Wow. It's like 10 people in here, which is exactly the reason why I don't work day shift. But anywho, my name is.
Hey, so just so you aware, I'm a nurse and I know everything that's going on. And I'm watching everything that's going on.
That is very useful information. Can I have a second with you outside just for a moment?
Of course I will. Of course.
Okay, all right. First of all, I'd like to say I'm so happy here right now because I'm ready to go home. So here's my stethoscope because I see that you don't have one. And you can go ahead and clock in if you haven't because I'm about to give a
I'm
report.
so confused. I don't work here, so what is it about?
I assumed that when you told me that you was a nurse, that you was ready to take over my job and do it for me.
I don't want to do a job for you. I was just saying that I'm a nurse and I know, what you're
And
doing.
if that's the case, I would appreciate if you let me do my job. Thank you. Good morning, guys. How you doing? I'm just gonna talk about. I'm debriefing. I just finished my 12-hour shift, and let me tell you, being a nurse in today's age and the stuff you have to deal with on a daily basis is for the birds. Don't you hate like when you go into a patient's room and, first of all, I'm a people person, but sometimes when you have a small room and you got like 15, 20 family members in that room and you step in, it's kind of a lot of people. And then on top of that, when you introduce yourself, then you always have that one family member, like, I'm a nurse and I know everything that you're doing and I just want to let you know that I'm a nurse. And it's like, okay, you want my job? Like, do you want to work? Like, here, you take my stethoscope, you take my badge, go ahead and start working. And of course, their reaction is, well, that's not my job. Well, let me do my job then, because it doesn't really matter. It's irrelevant that you're even a nurse. Half the time, they're not even a healthcare professional like that. They're not a nurse. They're just saying that. One instance, I was like, when somebody came at me with that, I said, well, what school did you go to? Crickets. I'm like, you should have thought about that before you preached out that you was a nurse. It's like, really? So, yeah. Little things like that that goes on in the field, and you try to come up with the best solution because you want to be nice and professional, but it's really unnecessary to know that you're a nurse. If anything, you're making it harder for the care because you're trying to, I know everything, that's just not my thing. But yeah, what you guys think about that actually? Like, what kind of reaction would you give if you had a family member who comes in and the first thing they want to do is tell you they're a nurse? Like, comment below. Let me guys know what you think about that. In the meantime, my whole goal for this YouTube channel is to just present problems and come up with resolutions and just cause the engagement. But anyways, my name is Jumping Jackson. This is my really first video on YouTube talking about nursing. So if you have any questions, let me know.